All right, welcome to the Explainer. Today, we are going to crack the code on one of the most dreaded exams out there for nursing students, the HESI exit exam. We're going to show you how to stop falling for the same old tricks and start thinking exactly like the test. So let's just jump right in, because this is the heart of the problem. You're a great student, right? You've got good clinical instincts. But on the HESI, those very instincts can set you up for failure. And you're probably wondering, why? It's because the test just isn't playing by the same rules you do in a real hospital. And look, this is not your fault. I mean, you've been trained to think and act like a real nurse. But the HESI, it's a different beast. It's testing something else, something way more rigid. That's why it feels so, well, wrong sometimes. Okay, so think about it like this. In the real world, you're all about holistic care, collaboration, the big picture. But in HESI world, it's all about these super rigid priority rules. It's about immediate survival and, honestly, just recognizing patterns. The test isn't asking if you're a compassionate nurse. It's asking, can you spot my pattern over and over again? So the big question is, how do we spot those patterns? Well, there's kind of like a master key, a secret sauce, if you will, to unlock this whole thing. It's one single rule that you have to apply to pretty much every single question. And here it is. This is the golden rule. You have to burn this into your brain. Number one, always are the ABCs: airway, breathing, circulation. Then it's all about safety, protecting the patient from immediate harm. After that, you prioritize what's new and acute over what's chronic and expected. You deal with the unstable patient before the stable one. And finally, and this one is huge, you assess before you intervene, unless, of course, it's an immediate life threat to the ABCs. This is the filter you're going to run every single answer choice through. And if you're thinking, how am I going to remember all that in a high-pressure exam? We got you. Just think PASSA. It stands for protect, airway, stabilize the unstable, look for a status change, and assess before you act. It's like your quick and dirty checklist when your brain is fried. All right, so theory is one thing, but let's put this into practice. Let's see how this golden rule just completely demolishes some of the most common traps the HESI loves to set. Okay, here we go. A classic scenario. A client reports acute chest pain. What's your gut reaction? Your every instinct is probably screaming, do something, give a med, call a code, right? Well, that's the trap.
See, your instinct says meds, but what does our golden rule say? Assess before action. The priority is to get a 12-lead ECG. Why? Because the HESI world demands data before you act. That ECG is the piece of evidence you need to make the right call.
Okay, let's try another one. This is an infection control question that gets so many people because it plays on our everyday habits on the floor. So your habit, what you do 100 times a day, is probably to reach for that alcohol-based hand sanitizer. But the HESI rule here is about pure knowledge and safety. And the fact is, alcohol does not kill C. diff spores, period. The only correct answer is soap and water. This fits right under the S for safety in our golden rule. You're preventing harm, you're stopping the spread. And hey, speaking of safety, here's another category the HESI is absolutely obsessed with: antidotes. Knowing these is a huge deal because they are critical, time-sensitive, life-saving interventions. And you better believe these three pairs show up constantly. Warfarin gets vitamin K, heparin gets protamine sulfate, and opioids get naloxone. This is just one of those things you just gotta know cold. It's free points. All right, now let's talk about the big one, the moment that makes every student's heart drop. You get a question with some crazy medical term you've either forgotten or maybe never even heard of. First thing, don't panic. So, you see a question that says a client has bronchiectasis exacerbation, and your brain just freezes on that word, right? You start thinking, oh no, I don't know what that is, I can't answer this. But guess what? That word is a red herring. It's a total distraction. So here's the rule for this situation. You have to train yourself to just ignore the scary word. Seriously, the HESI is not a vocabulary test. It's a prioritization test, and it always gives you the real clues you need somewhere else in the question. So let's look at that question again and break it down. What are the clues? You've got the danger word SOB, shortness of breath. You've got the danger number, O2 sat at 85%. What does that scream to you? It's a breathing problem. So where do you go? Straight back to the golden rule. This is an airway, breathing, circulation issue. See, you didn't need to know a single thing about bronchiectasis to know that your priority is oxygen. This right here, this should be your mantra. Say it to yourself during the test. If I don't know the word, I still know the patient. Focus on the signs, the symptoms, the vitals. Focus on what's actually happening to the person, not the fancy label.
Okay, so let's bring this all home. To really conquer this exam, you have to make one final, super important mental shift in how you look at every single question. You have to stop asking yourself, what's the best nursing action here, or what's the most comprehensive care? That's real-world thinking. For the HESI, your new question, the only question is this: what will keep my client alive the safest and the fastest right now? You're not looking for the best answer anymore. You're looking for the first answer, the most immediate life-saving one.
Seriously, let this become the little voice in your head for every single question. As you read each option, ask it, does this keep them alive and safe right this second? That's how you cut through the fluff and find the HESI correct answer. The bottom line is, you don't have to go in there and guess. You have one single, powerful framework, that golden rule, to guide every single decision. Trust it. You see, this isn't about just memorizing a million random facts. It's about learning the language of the test itself. You've got the tools now. You get the pattern. You are so ready for this. So, are you ready? Are you ready to stop thinking like a nurse in a hospital and start thinking like the HESI exam itself? Because with this new mindset, you can walk into that testing center with a strategy, with confidence, not with anxiety. You've got this.